Hello, my name is Christina Adams, and I'm going to talk to you about attachment-focused family play therapy. Some major theorists of this theory are Guy Diamond, which he is a professor at Emeritus University of Pennsylvania School of Medicine, and he's a former associate professor at Drexel University in the College of Nursing and Health Professions. His primary work has been focused on youth suicide prevention and treatment research. The next one we have Gary Diamond. He's a professor and chair at the Department of Psychology at the Ben Gurion University in Israel. And last but not least, we have Suzanne Levy. She's part of the ABT International Training Institute as well as Guy Diamond. She's previously executive director of strategic initiatives and training of the ABFT training program at Drexel University's College of Nursing and Health Professions. And based in some of this theory is based on principles from John Bowlby's attachment theory, which means humans have an internal need for connections. So the epistemology and the theoretical assumptions of this theory is that the quality of relationship influences the child's social, emotional development, emotional regulation, and the ability to form healthy relationships, and that parents provide the foundation for developing a healthy sense of self, security, and regulate emotions. Some major concepts are that children who don't have a parental emotional support system have a tough time forming relationships later on, along with a positive self-view. Children raised with a secure attachment patterns are resilient and able to navigate the difficulties of healthy relationships due to regulating their emotions. There's three attachment styles: secure, anxious avoidant, and anxious ambivalent. And we need to understand the connection between behavior and the quality of relationships within the family. Families provide building blocks for learning about the world and relationships, and that relational experiences within the family will form the foundation of interpersonal maps regarding relationships for the traumatized child and their siblings. Children desire to have a good relationship with their parents and feel connected to them and have a sense of belonging. When children thrive, they have a positive, loving relationship with their parents that's balanced and secure, with structure, and that contains limit settings. An effective parent is a self-aware parent. The selected toys and materials for this assignment, I have chosen to split it up into the couple of the phases that are in this technique. First, for the observational assessment, this is where we observe how families interact and we get to discover any patterns that are within the family system. I'd like to have a 60-piece puzzle just to see how they work well together as a team to figure a task out. Also, the life board game, just to see how they interact as a family playing a regular board game. No competition involved, just, or maybe just a slight competition involved. And then a pack of cards, which can be utilized to do anything. You could play Goldfish is a popular one. I think War is the other one, if I'm not mistaken, from when I was younger. Safety and engagement in the realignment phase. I'd like some action figures and Barbies for teens to role play a scenario that has been a concern and causing them distress. And hot potato, not really used as a hot potato, but as a form of holding the potato and expressing their emotions. For the therapeutic space, I'd like about 4 adult chairs, a therapist chair, a coffee table, a small table for sitting, kind of like a small like nook table, 2 bean bags for the teenagers and some of the family to sit on, an area rug, a desk, a small bookshelf, a desk lamp, a floor lamp, and an end table. The focus of interventions, one of them is the family space skills. This is where the parents are taught space skills used during the session. So space stands for structure and flexibility, playfulness, aware and present, curiosity, empathy, and acceptance. The next focus of interventions are the 3 R's of relationships. And this is how to utilize family space skills. So the first one is reflexive communication. It's a style of communication that focuses on gathering info during the interaction to help understand what's being discussed. And the goal of this is to seek info rather than assuming what's being communicated. The next one is regulate emotions. It's when parents regulate their emotions, they can make more critical decisions to effectively use the space skills. Helps access the wise mind, which is the emotion and logical mind. And the size of the parent's window of tolerance determines the threshold for emotional distress and emotional regulation. The last R is the repair the relationship rupture. Parents must repair the relationship with their child and teach their children how to repair their own relationship. They need to recognize their role in the rupture and identify what triggered their behavior. Repairing ruptures helps reestablish trust. The treatment process consists of 5 sessions, 4 sessions of therapy, and 1 session for feedback for the parents. It will continue to repeat until termination, which really depends on the treatment plan and the progression of the family. The sessions are videotaped to make observations for feedback. Prior to the initial session, the therapist will meet with the parents to get any family history on the background. It's to identify history that maybe has influenced the relationships and attachment patterns that they'll see within the family system. The therapist must establish a sense of safety within the sessions, and identifying any history or trauma beforehand will help the therapist be more aware. Therapists get as much information about the nature of the trauma, severity, duration, and extent of the traumatic experience, its impact on the child's functioning, the age of the child when the trauma happened, and the relationship of the child to the abuser, and what was done to address the impact of the trauma. If the child was experienced abuse by a family member, that member first acknowledge that they take accountability before they're introduced into sessions, especially if the abuser is a parent. The first session is when the therapist meets with the family the parents and the children. They discuss any concerns about what may be said and maybe identify a plan that everyone can agree upon. So there's 4 phases, and this is after the first session is completed. The first phase is the observational assessment phase. Obviously, the focus of this phase is to get a sense of how the family interacts and recognize patterns with little to no intervention from the therapist. And it lasts 3 to 4 sessions. And this is where the puzzle will come into play to see how the family interacts with each other to accomplish a task. The next one is the safety and engagement phase. It focuses on family members to develop a sense of safety within the change process and to commit to the process. This is where the therapist provides a lot more structure and activities that will help the families recognize the importance of repairing their relationship. And this is where the therapist takes a more directive role. They lay the foundation for building trust with family members by making little deposits of the family emotional bank so that withdrawals in the future won't shake up the family unit. So they'll put a ton of emotional deposits in this family bank so that later on when the family encounters an emotional trauma, it won't particularly shake them up too much. This phase can take many, many sessions and it's really dependent on the needs of each family. The realignment phase is where the therapists therapeutically challenge unhealthy relationship patterns within the family. They monitor the family's ability to tolerate emotional distress and signs of emotion dysregulation and disassociation, while helping family members recognize their triggers for the behaviors. They focus on helping family members learn and implement healthy changes to improve relationships. And this is where the bulk of the change occurs. It's also the longest part of the therapy process. The attunement phase is the termination phase of the treatment. Parents and children have successfully identified and replaced unhealthy relationship patterns. It ensures parents can effectively use the skills learned in treatment with their children. Types of clinical interventions. The therapist must be present and active in sessions. They take an active approach during sessions, which means they must be attuned to their own internal experiences so they can give their undivided attention to their clients. The therapist suggests play activities during their sessions. They also make observations during sessions from the videotaping and offer feedback to coach the parents. The therapist must be aware of how they join the family unit because countertransference can heavily happen in this model because they're so attuned to the family throughout the sessions. Therapists must be aware of how they joined it so they can exit the family system at the end of termination of treatment. And if they cannot identify how they entered the family unit, it'll be difficult for the therapist to exit. This model tackles diversity and privilege and social location in a unique way. It's not directly addressed, but it's present when the family history is given. The therapist considers types of activities presented so the parents can replicate the treatment when treatment is over. So the way this model handles diversity, privilege, and social location is just that when history is given, that's kind of when it's brought to the attention of it. Therapists go into with an open mind in these sessions, and they are open book. Um, there are some legal and ethical considerations to this model. Not much research has been done on other socioeconomic populations. It has been limited to low-income minority youth, so that is one limit and ethical consideration. And sometimes therapists may not follow the manual for treatment, which can negatively impact the outcome of the sessions. Some telehealth alterations and recommendations. Prior to starting sessions, therapists should consult with the parents to see what board games they have on hand and if they need additional games or have any other additional games that the therapist can utilize during the sessions. The therapist would discuss with parents if additional items were needed and could be accommodated. For family sessions, it was best to find a location where everyone can be seen in the camera as well as them seeing the therapist. Also, due to limitations with telehealth, not all phases could be done adequately. It would be in my recommendation that telehealth would be used in emergent situations due to the interventions in this model. The 13-year-old girl presenting at high risk for suicide, she was referred to ABFT after failed suicide attempts. Her SIQ JR score was at 71, which was greater than 31, which considered clinically significant. And her Beck Depression Inventory score at baseline was 37, which was severe depression. By week 4, her SIQ JR score went to 27. Week 8 was 15, and week 12 is 13. These scores show significant improvement using this treatment plan. Sarah and her mother were in treatment for 12 weeks, and they had 4 tasks: relational reframing, adolescent alliance, parent alliance, and repairing attachment. Vanderspeck studied ABFT for adolescents and young adults with suicide ideation and depression. 25 families completed at least 10 sessions over 7 months. The baseline for the SIQ-JR was 36.31, and once treatment was completed, the baseline average decreased to 27.83. It improved family functioning and emotional problems. Diamond et al. Studied 66 depressed adolescents. Participants were either assigned to 12 weeks of ABFT therapy, ABFT, or 6 weeks of waitlist control. Participants receiving ABFT showed an 81% decrease in major depressive disorder symptoms post-treatment, and it's associated with greater rates of clinical recovery on suicidal ideation post-treatment for this model. It also improved family cohesion and attachment. Program recommendation summary. Attachment-focused family play therapy emphasizes how individuals' relationships influence their behavioral, social, and emotional development and the ability to form relationships. This model aims to focus on the individual relationships that are causing concern, and the therapist will look at the emotion and attempt to link it to the behavior causing distress. In turn, the client becomes more aware of the emotion and capable of coping with that emotion or the emotions that arise. Everyone has emotions and feelings, and we can't deny that they have an influence on our daily lives. Learning to regulate those emotions at a younger age will aid that individual for the rest of their life and set them up for success. Thank you.